My name is Fiona Madre, and I will be talking about the market for healthcare insurance. Chapter 6. Did you know 15 to 16% of U.S. citizens are without insurance? This has led to the rise for reform. In order to do so, we must understand why those uninsured lack coverage and how do we discourage this. Types of insurance. One insurance approach is the one that provides reimbursement for certain medical costs or direct payments to those unable to work due to injury. Social insurance approach is casual, basically what assistance programs use like welfare and cash assistance. These models ignores expected spending when it comes to premiums. Types of insurances. Premiums and PPOs. Premiums is experience rated, determined by spending, history, and lifestyle choices. It's uniform within a group. PPOs, or Preferred Provider Organizations, it's a comprehensive healthcare coverage where providers are responsible for the healthcare services. This also has a fixed fee. Private insurance demand. Individuals usually enter insurance contracts to spread or minimize risk. Contracts are sold for a premium based on expected costs. Traditional term, life insurance. Theory of risk and insurance. This is for individuals who enter into an insurance contract, share the uncertainty of financial risk with others. The probability that someone in the group will suffer from a risk is impossible to determine. Some are more willing to take chances than others. The more income, the more the level of utility or value. Risk pooling. A risk-averse person will pay to avoid consequences of risk. Risk pooling works as long as the group purchasing insurance has the same probability of illness as the overall population of estimation. Many groups have different utility of income curves. The goal is to spread the risk of high cost and low probability events over all individuals. The healthcare marketplace. This is where you'll see a large reliance on third-party payment companies. Favoritism for employee-based health insurance has distorted the average employee compensation packages. The goal is not to spread risk, but to keep out-of-pocket spending to a minimum. Moral hazard economics. This economic modeling is used to estimate costless information. Contracts are expectations for future behavioral patterns. This is not helpful in predicting those that do not follow those patterns, such as following morals or actually doing something bad when nobody's looking. So it's not really exact, but it helps. Adverse selection. This is seen when patients have more information about expected medical costs than insurance companies. Patients might conceal their true risk to find loopholes, which distorts the number that is insured for their true risk. Solution for all these problems? Insurers charge deductibles and co-insurance. Deductibles are sets the amount of spending before the insurance pays or kicks in for parts of the claim. This helps insurers from paying pre-existing conditions that they were not aware of. So, a way around the loophole. A perfect insurance plan. This would be the plan where individuals pick their medical care that they want to pay for, that they know they will use. A risk-adverse patient would be willing to pay premiums because they know they need quality care and want it. There is a balance between greater risk and cost of moral hazard. State-level insurance regulations. Federal and state governments have tried to correct the deficiencies in health insurance markets. For example, state governments have passed over 2,200 health insurance mandates. 1. The Affordable Care Act affects insurance regulations for those to have care and to have it accessible to them. Guaranteed issue entitles any applicant to a health policy. So anybody that applies has to get some type of insurance. These mandates impose economic and social costs on intended beneficiaries. This determines what benefits to offer, include, and how insurance companies manage enrollment. There is no tangible effect on the availability of insurance or premium costs. Self-insurance. This is private insurances that underwrite so that they can price the risk associated with the event by estimating the expected losses they may occur. Firms do not contract with an insurance company for financial risks. The risks are limited through reinsurance or caps on spending. Uninsured medical care. More than 20% of uninsured have incomes 3 times the official poverty level. Those that earn up to 400% of poverty level will be eligible for premiums and copayments. Insurance is associated with level of income. 75% of those that are uninsured actually have a labor job. The correlation between insurance and health: lack of insurance equals poor health. 1/3 of the care to insured is inappropriate or unnecessary. This helps discourage those from getting aid and insurance because they believe it's unnecessary. Lack of insurance leads to a lower level of utilization. A safety net. It is illegal for hospitals to deny care to anyone in need due to the Emergency Medical Treatment and Active Labor Act. Universal insurance coverage has principles of subsidization of those who cannot afford coverage. The healthy may face premiums to exceed the maximum value of the insurance. Discussion question: provide 3 examples of moral hazards at play.